Nearly 9 out of 10 men with osteoporosis have absolutely no idea they have it. No pain, no symptoms, no warning, until the day they bend down to pick something up or stumble slightly, and a bone that should have survived that impact simply shatters. 1 in 2 women and up to 1 in 4 men will break a bone in their lifetime due to osteoporosis. Today I am going to show you exactly what osteoporosis is, why it has been falsely labeled a women's disease for decades while millions of men go undiagnosed, the 7 silent signs your bones are already dangerously weak, and the 1 scan that measures your bone strength before a fracture tells you what your doctor should have caught years earlier. Sign number 3 is happening to millions of people right now, and every single one of them is blaming something else entirely. Approximately 54 million Americans aged 50 and older have osteoporosis or low bone mass right now. Osteoporosis happens when your body loses bone faster than it can replace it, leaving bones that look normal from the outside but are riddled with holes and weakened from within, like a structure whose internal beams have been quietly eaten away. Osteoporosis is called the silent disease because it gives absolutely no symptoms until the patient experiences a fracture, by which point the bone loss has already been progressing for years or even decades. While there is no doubt that women are more exposed to osteoporosis after menopause, the literature clearly shows that physicians drastically underestimate osteoporosis in men, and the risk of fatal complications from hip fractures is actually higher in men than in women. In men, only about 2% are diagnosed before a fracture occurs. 2%, meaning 98 out of 100 men with osteoporosis find out about it when a bone breaks. Here are the 7 silent signs your bones are already weakening right now. Warning sign number 1, you are getting shorter. This sounds too simple to be a warning sign, but it is one of the most reliable early indicators of spinal osteoporosis. Spinal fractures in osteoporosis can occur without noticeable pain, but lead to height loss and posture changes that develop so gradually most people never connect them to their bones. Vertebrae, the bones of your spine, can silently compress and partially collapse under the weight of your own body when their internal structure is weakened. Losing more than 1 inch of height compared to your tallest adult height is a significant red flag that warrants bone density testing immediately. Warning sign number 2, a stooped or hunched posture that has developed gradually. When multiple spinal vertebrae partially collapse, the spine begins to curve forward, creating the characteristic rounded, hunched posture called kyphosis. Most people and their families accept this as a natural part of aging, when it is actually the visible evidence of multiple silent spinal fractures that have already occurred. A spine that curves progressively forward over years is a spine that has been silently fracturing. Warning sign number 3, back pain with no clear injury or cause. Osteoporosis is a silent disease as bone loss is gradual and asymptomatic. However, when vertebral fractures do cause pain, it is typically a sudden onset of sharp back pain localized to the spine, often occurring during a completely ordinary movement like reaching for something on a shelf or getting out of a car. This pain gets blamed on muscle strain, a slip disc, or simply a bad back, and most people treat it with painkillers and rest for weeks, while the fractured vertebra heals in a weakened position, permanently altering the spine's alignment. Warning sign number 4, breaking a bone from an impact that should not have caused a fracture. A fracture from a minor fall from standing height. A rib that breaks from a strong cough or hug. A wrist that shatters from catching yourself on a handrail. These are called fragility fractures, and they are the defining event of osteoporosis. A bone that breaks from low-impact force is a bone that has already lost dangerous amounts of its internal strength. By 2025, experts predict osteoporosis will be responsible for 3 million fractures annually in the United States. Every one of those fractures in a bone that should have survived its impact. YouTube. Warning sign number 5, receding gums and loose teeth with no dental disease explanation. The jawbone, like all bones, loses density in osteoporosis. When jawbone density decreases, the bone that anchors your teeth becomes thinner, causing gums to pull back and teeth to loosen or shift. Dentists frequently notice this pattern on dental x-rays years before any other osteoporosis symptom appears, but the connection is rarely communicated to patients. If your dentist has mentioned bone loss around your teeth, this is a signal worth discussing with your primary care physician. Warning sign number 6, a family history of osteoporosis or hip fracture. Osteoporosis is a systemic metabolic bone disorder that affects men and younger individuals with secondary risk factors including chronic diseases, long-term medication use, and malnutrition. But genetics is one of the most powerful risk factors of all. If a parent or sibling fractured a hip from a minor fall, your bone density trajectory may be following the same path. This is not a symptom, but it is a warning loud enough to warrant a bone density scan regardless of how strong you feel. Warning sign number 7, long-term use of corticosteroid medications. Prednisone and other corticosteroids, prescribed for conditions ranging from asthma and arthritis to inflammatory bowel disease and skin conditions, are among the most powerful destroyers of bone density in modern medicine. Even short courses of high-dose steroids accelerate bone loss, and patients taking these medications long-term face dramatically elevated osteoporosis risk that their prescribing doctors frequently fail to address. If you have taken oral steroids steroids for more than 3 months in the past year, ask your doctor specifically about your bone density. Now, the one test that reveals what is happening inside your bones before a fracture delivers the news. It is called a DEXA scan, dual energy X-ray absorptiometry, and it is the gold standard for measuring bone mineral density. It takes about 10 to 20 minutes, involves no needles and very low radiation, and produces a T-score that tells you exactly where your bone density stands relative to a healthy young adult. A score between -1 and -2.5 indicates osteopenia, low bone mass, the warning stage before osteoporosis. A score below -2.5 confirms osteoporosis. Current screening shows significant gender disparities, with 60 to 70% of postmenopausal women receiving appropriate screening, compared to only 15 to 25% of men over 70 years. If you are a man over 70, or a man over 50 with risk factors, this scan needs to be part of your medical care. Ask for it by name. DEXA scan. Osteoporosis is one of the most treatable conditions in medicine when caught before fractures occur. Calcium and vitamin D optimization. Weight-bearing exercise. Medications that actively rebuild bone density. The difference between a spine that fractures silently for years and one that stays strong for decades is early detection in action. If this video helped you, share it right now with every man over 50 in your life. Because the myth that osteoporosis only affects women is costing millions of men their mobility and their lives. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently destroying your sleep right now, not just making you tired, but quietly increasing your risk of heart attack, stroke, and diabetes every single night you go undiagnosed, and the sign that appears every morning that most people have completely normalized.